The country is exposed to the coronavirus more than the government would like you to know. Various sources who are in direct contact with the situation at the main airport, that's the Jomo Kenyatta International Airport, and whose versions of the situation are independently aligned, say that they are not trained to handle the situation, do not have the proper protective gear, lack the numbers to effectively handle the situation, and add that to the staff at the airport are living and working in fear for their well-being. In short, they are saying the government is lying to you, as it paints a picture that is only but a mirage. Helen Aura opens our bulletin with the damning revelations.
The reality of 239 passengers on board Southern China Airlines plane disembarking at the Jomo Kenyatta International Airport on the morning of 26 February 2020 has not only raised concerns but brought to the fore the risk Kenyan is exposed to. This comes right from the preparedness or lack of it thereof of the personnel on the ground.
The level of preparedness at JKIA is wanting. This is because one can't really say there is much in place, even for the grooming companies, the person who drives the cargo and the person who ferries the passengers in the buses. The only thing you can say they are provided for are the masks and the latex gloves.
The government says that over 600 personnel have been deployed to attend to the screening, but sources indicate that they are actually about 60 on the ground. They are comprised of only one medical doctor, nurses, clinical officers, and public health officers. The lead on such a situation should be infectious diseases specialists, but there are none in the JKIA team, which is sagging under the weight of understaffing. There are more gates than officials, leaving them very thin and less efficient. With each shift having about 12 people at work, there are lapses where some people gain entry without being screened, and some staff, such as cleaners and helpers of persons with disabilities, access planes without the relevant gear and get back into the airport. It gets worse.
In terms of disaster and epidemic training and drills, we are at zero. We have not been trained for the situation.
This video taken at the airport shows how the screening process is conducted upon arrival at the Jomo Kenyatta International Airport. An official is seen hurriedly screening passengers. The National Youth Service officials are also at hand to aid in crowd control. They are all masked. But there is a problem. They are all in surgical masks, which do not shield them from getting infected. The ideal masks are called N95 masks or respirators, which are ideal for this case. Sources indicate that there are some in store but are not being issued to everyone. The masks are being issued to staff who are asked to reuse them for about a week, yet they should be discarded after use. In regards to equipment, there are 2 thermal scanners, one of which is not working. There are only 6 thermal guns expected to be used to screen the thousands of travelers, and they are not always at hand to deliver.
We had a case where the thermometers failed to work. They overheated. So even what the health ministry is purporting that they were screened and they were okay to mingle with the people in the societies, the passengers, is just a hoax.
One of the ways of steering clear of the virus is washing of hands and general hygiene. At JKIA, water is switched off at midnight and back on at about 4 a.m. This leaves even toilets without running water to flush or wash hands, facilities that are shared by travelers and staff alike. NTV has been seeking access to the airport to film the screening process for weeks, but keeps getting ping-ponged to different offices, none of which has granted access. The details in this report, which is not exhaustive of the situation and exposure, may just explain why. Helen Aura, NTV.